Hi, I'm Johnny Blackwell. I'm a research fellow at St George's, and I'm going to be talking about our research on Crohn's disease, stomas, and depression. This research is supported by a grant from Crohn's and Colitis UK. We know that roughly 50% of people living with Crohn's will develop complications of either a stricture or fistula, and a substantial number require surgery, and in some cases, stoma formation is recommended. However, previous research found patients are willing to accept more than a 5% risk of death in order to avoid having a stoma. So we decided to look at the relationship between stoma formation and mental health. In particular, stoma versus non-stoma forming surgery, whether there's a difference between temporary and permanent stomas, and if timing of temporary stoma reversal is important. We used a GP research database and hospital episode statistics data to identify all patients with Crohn's disease who had their first intestinal surgery between 1998 and 2018. We grouped individuals according to their stoma status after surgery, including no stoma, temporary stomas with early reversal surgery being within 1 year, and late reversals after 1 year. And of course, we had individuals with permanent stomas as well. We used Cox Regression to determine the likelihood of antidepressant medication use after surgery, and we adjusted for these covariates. We identified 1,272 individuals who had intestinal surgery, of whom 871 had no stoma, 191 had a temporary stoma, and 210 had a permanent stoma. What was the impact of a permanent stoma on rates of antidepressant medication use? Well, you can see here individuals who had permanent stomas were much more likely to start an antidepressant medication after surgery than those who had no stoma. What about temporary stomas? Well, when we add those who had late reversal of their stoma after 1 year, temporary stomas were associated with much higher rates of antidepressant use. However, individuals with early reversal of a temporary stoma were not at increased risk of antidepressant medication use. This was confirmed in our Cox regression. In summary, this is the first study to demonstrate permanent stomas and temporary stomas with late reversal are associated with increased antidepressant medication use. However, temporary stomas with early reversal within a year are not associated with increased antidepressant medication use after intestinal surgery. Our research demonstrated people living with stomas for more than a year are at high risk of developing mood disorders, and patients should receive counselling before surgery and psychological support afterwards. I'd like to thank my co-authors. Thanks for listening.